Good day, everyone. Our group will be reporting about contagious caprine pleuropneumonia or CCPP. Contagious caprine pleuropneumonia or CCPP is a severe, highly infectious respiratory disease affecting goats. It is known for its high morbidity and mortality rates, making it one of the most economically devastating diseases for goat farmers globally. While not endemic in the Philippines, this disease is regularly cited in Africa, the Middle East, and parts of Asia. For its etiology, the disease is caused specifically by Mycoplasma capricolum subspecies Caprine pneumoniae, or MCCP for short. For its characteristics, it lacks a cell wall and is resistant to beta-lactam antibiotics such as penicillin. It is a very small pleomorphic organism, pleomorphic meaning it can appear in many shapes, which helps adhere to respiratory epithelium. It is fastidious and difficult to culture, and it survives poorly outside the host. For its transmission, it spreads primarily through inhalation of infected droplets or through aerosol transmission when goats are in close contact. And it is highly specific to goats, though it has occasionally been detected in wild ruminants such as wild goats, Laristan mouflon, which is wild sheep, in the Nubian ibex, gerenuk, and sand gazelles. This illustration shows the transmission of MCCP from the diseased goat to the healthy goat through direct transmission of aerosolized infected respiratory droplets. In this image on the left, it shows MCCP transmitted to the goat via inhalation route. And then direct contact with affected animal is the main source of contamination. However, the MCCP cannot be transmitted from the infected animals to humans. MCCP can also be spread by airborne transmission or through infected objects. However, transmission from infected objects to the animal is not clear as of now. MCCP is also fragile in the environment, particularly when it is exposed to UV radiation, which inactivates the MCCP in the environment. It has poor survival, hours to days in the environment, but it can survive on average 3 days in tropical areas and 2 weeks in temperate zones.
So now I'm going to talk about the pathogenesis of contagious caprine pleuropneumonia or CCPP. It begins when a goat inhales respiratory droplets containing Mycoplasma capricolum, subspecies Caprine pneumoniae, from an infected animal. These droplets enter the respiratory tract and reach the lower airways and lungs. Once inside the lungs, the organism attaches to the ciliated epithelial cells lining the bronchi and bronchioles. Because Mycoplasma lacks a cell wall, it forms a close attachment to the host's cell membrane, allowing it to persist and avoid early immune destruction. The organism then produces toxic metabolites, including hydrogen peroxide and reactive oxygen species. These substances damage the respiratory epithelial cells and destroy the cilia. As a result, the normal mucociliary clearance mechanism becomes impaired, meaning mucus and pathogens can no longer be effectively removed from the respiratory tract. With this defense mechanism compromised, the bacteria multiply rapidly within the lung tissue. This triggers a strong inflammatory response. Neutrophils and macrophages migrate to the site of infection, and inflammatory cytokines are released. These mediators increase vascular permeability, allowing fluid and plasma proteins to leak into the alveoli. The leaked protein-rich fluid contains fibrin, which accumulates within the alveoli and pleural cavity. As inflammation worsens, the infection spreads to the pleura, leading to severe fibrinous pleuropneumonia. This condition is characterized by lung consolidation, pleural thickening, and accumulation of pleural effusion. Due to consolidation and fluid accumulation, normal gas exchange becomes severely impaired. Oxygen levels in the blood decrease, leading to hypoxia. Clinically, the animal develops respiratory distress, increased respiratory effort, and severe dyspnea. And in advanced or untreated cases, prolonged hypoxia and systemic inflammatory effects may result in toxemia, respiratory failure, and eventually death.
Contagious caprine pleuropneumonia, caused by Mycoplasma capricolum subspecies Caprine pneumoniae, produces a characteristic spectrum of gross pathological lesions that are confined almost exclusively to the thoracic cavity. These lesions vary according to the stage of disease, per acute, or chronic, but consistently demonstrate unilateral involvement and absence of marked interlobular septal thickening, features which distinguish CCPP from other mycoplasmal pneumonias of goats. In the per-acute form, death occurs within 24 to 72 hours before classic consolidation develops. Findings include lung congestion, dark red discoloration without firm hepatization, and pulmonary edema with the white foamy fluid in the trachea. Pleural fluid is minimal or absent. The acute form presents with unilateral lung consolidation in 100% of cases, showing red to port wine hepatization, firm liver-like texture, and no crepitus. The pleural cavity contains straw-colored serofibrinous fluid in approximately 91% of cases, and both pleural surfaces are covered with thick yellow fibrin coat. The affected lung is enlarged compared to the normal lung. Interlobular septa are rarely thickened, differentiating CCPP from other mycoplasmal infections, and early fibrinous adhesions may be present. In the chronic form, severe hydrothorax persists with thick fibrous pleural adhesions firmly attaching to the lung to the chest wall. Within the lung, encapsulated necrotic sequestra develops, walled off by fibrous tissue. The affected lung may be shrunken due to fibrosis or enlarged due to trapped air or fluid. Several diagnostic features are noteworthy, such as unilateral port wine hepatization with straw-colored pleural effusion, and absent septal thickening is virtually pathognomonic for acute CCPP. Per acute death with foamy tracheal fluid raises suspicion in outbreak settings. Chronic pleuritis with unilateral adhesion and sequestra characterizes resolved diseases. Gross examination typically reveals a lung covered with a thick yellow fibrin and showing pleural adhesion. Affected lungs demonstrate red hepatization, appearing larger than the non-infected lung, with cat surfaces showing homogeneous port wine discoloration. Straw-colored pleural fluid aspirated from the thoracic cavity completes the characteristic gross pathological picture.
The images provided are histopathological slides labeled C and D, showing lung tissue affected by the acute form of contagious Caprine Pleuropneumonia. Image C on the left, this lower magnification view shows a dense infiltration of cells within the lung. A central feature marked with an asterisk shows an area that is completely filled with neutrophilic granulocytes. Image D, or in the right, this higher magnification view focuses on the blood vessels and surrounding tissue. The black arrow points to fibrinoid degeneration and necrosis of the vascular wall, which indicates that the infection is severe enough to cause the death of the tissue making up the blood vessel walls. The combination of neutrophils filling the airways and rapid tissue death or necrosis confirms that the disease is an acute aggressive stage. Because the airways are physically blocked by inflammatory cells and the blood vessels are breaking down, the affected animal would have experienced extreme difficulty breathing and poor oxygen exchange. As the diagnosis is CCPP, these slides represent a major biosecurity risk. This disease is known for rapid spread and high mortality rates in goat populations. These microscopic pictures hallmark specifically the vascular necrosis and a specific pattern for lung inflammation, allows veterinarian to distinguish CCPP from other common respiratory infections. The left microscopic picture shows a large distinct area of tissue damage. The black arrow points to an abscess. This abscess contains a center of coagulative necrosis and is surrounded by fibrous encapsulation, which is the body's way of walling off the infection with a scar-like tissue. In the right picture, this higher magnification view focuses on the bronchiole. The asterisk clover symbol indicates the beginning of bronchiolitis obliterans. This is a process where the airway becomes blocked or obliterated by inflammatory tissue and scarring. Unlike simple inflammation, bronchiolitis obliterans represents irreversible scarring of the airways. Even if the animal survives, its lungs capacity and overall productivity will be permanently reduced. The encapsulated abscess in the image E are significant because they can hide the bacteria from the animal's immune system, and even from some antibiotics. Animals with this lesion may appear to have recovered, but can remain chronic carriers, potentially shedding the pathogen and infecting others in the herd later. These slides confirm that the infection has persisted long enough for the immune system to transition from an acute response to an organized, chronic attempt at containment. Identifying these specific chronic structures helps pathologists distinguish CCPP from other types of pneumonia that might not produce this exact pattern of abscessation and airway obliteration. For this picture, the arrowhead points to a bronchiole containing fine thread-like structures. This is called fibrin, a protein involved in blood clotting that forms during intense inflammation. It is also seen in leaking into the surrounding alveoli. The asterisk marks a neighbor bronchiole that is completely obliterated. Instead of being an open tube for air, it is plugged with inflammatory cells, primarily neutrophils. The surrounding lung architecture appears thickened and busy, indicating widespread pneumonia and fluid infiltration. When fibrin threads and inflammatory plugs fill the bronchioles, air can no longer reach the alveoli. This leads to asphyxiation at a cellular level, as the animal's plumbing for air is physically blocked. The presence of fibrin in the alveoli makes the lung tissue stiff and elastic. This is known as hepatization, where the lung starts to look and feel more like a solid liver than a spongy air organ. The massive influx of inflammatory cells indicate that the immune system is overreacting to the Mycoplasma bacteria, causing collateral damage to the healthy lung tissue in an attempt to kill the pathogen. The specific combination of fibrin threads and bronchial obliteration is a classic diagnosis marker for CCPP, helping to rule out other types of goat pneumonia,